Thank you for the introduction. Thank you to the organizers for inviting me. I'm coming from the north of Germany, and I'm going to tell you why pools are cool. I work for the Schleswig Holstein University Medical Center, which has two campuses in Lübeck and in Kiel. By training, I'm anesthesiologist, so I'm a physician. But more than 10 years ago, I was lured into a controlling position, and so I'm administrator now. Healthcare providers, like our hospital and like probably most others, are in a squeeze. We're confronted with rising demands by demographics, by medical progress, by rising expectation from everybody, patient, regulators, insurances, etc. Resources are limited and limitations are increasing, and so we need to get more efficient. We have to reduce cost, we have to optimize reimbursement, and everything has to be done with more and more attention for patient safety. So this has, we mustn't reduce our level of service when trying to increase efficiency and reduce cost. A central point for that is master data, product master data, material master data, and so I have to tell you what our opinion is, what they're good for, and which aspects of material master data are necessary and important. And here I put patient safety first. Patient safety is an important goal, and for that, of course, predominantly you need to be able to safely identify a product. And if you also have the processes, you want to safely identify the caregiver and the patient. And you need product characteristics. I'm going to come back to that later. Then there's supply chain management. Again, for supply chain management, you need reliable identification for procurement, as we heard from very good examples from Hong Kong and from Australia. You need that for tracking. You need it for stock surveillance. You need classification and characteristics for procurement, for reporting, and I'm very impressed by the Australian nomenclature which addresses this aspect. And of course you need terms and conditions for procurement, and then there is the realm of clinical processes, including revenue, analytics, and then sort of also having the aspect of doing science, and big data is coming here. For that you need, again, identification and enhanced product characteristics. And it's not by chance that identification is at the core of all of these needs. So, I mean, you've seen this graphic a lot of time. Identification, of course, is key when a product is moving through the supply chain. So, secure and easy identification is a must. We need good data carriers, and we have to motivate the industry, the suppliers, to provide data carriers that are single carriers. Very sensitive. Single carriers containing both the device identification and the product identification in one carrier. And of course we need identifiers. And this has proven in our hospital to be a big burden. Presently, the situation is this. Master data communication at the moment is many-to-many, and is extremely burdensome and prone to error and causes a lot of work. We have trying to get flying a project of tracing material and using product identification at the point of care so we can associate the patient with the material, and has been extremely burdensome for the people in purchasing to get hold of master data as simple as identification of the product. We had to coerce it out of our suppliers, and it's actually Stone Age. The colleagues in purchasing are actually hunters and collectors in the true sense of the word. And when we have a beer together, or of course Tokai wine, then I can tell you nice anecdotes of their practice of hunting and collecting. And this is, where master data for me get a very emotional touch. To me, master data are collected with deep emotions, emotions like the ones when I see a beautiful person. In my case, it should be a woman. Not difficult to imagine. There's a lot of them in the room right now, and of course, that emotion, that deep emotion, is envy when I see that woman in the arms of another person. And I envy, for example, our pharmacist, because he has at his fingertips, in his computer, in our network, throughout the hospital, access to the National Pharmaceutical Database, which has been an initiative years ago. It's decades old in Germany. The Association of Pharmacists, working together with the pharmaceutical manufacturers, have established a database, and our pharmacist can subscribe to it. It's updated every 2 weeks, and he has every master data for drugs at his fingertips, and not so for other medical supplies. And of course, in this situation, the logical step, a step that other organizations have gone, and another organization I envy, of course, is the Australians with their national product catalog. And the logical step, which is a long-established principle in IT, is channeling data through a hub, so everybody has only necessity to talk to one counterpart. Of course, you need a little bit of translation at the entry of the data into your system, but the many-to-many communication is impossible, has turned out to be impossible, and this is the way to go. And so we're glad that we've been invited into a pilot project, join a pool, One World Sync, together with a number of other university hospitals in Germany, and then the company, the IT service provider that provides us with this little connector software is the Consens company in Hanover. So far about availability, we're very much looking forward to having the project run and getting good and reliable master data through the pool, through One World Sync. And just a little outlook of what our wishes would be about some more content. And here I want to go back to processes, the clinical processes, medical processes, and has been mentioned before, for a medical process to be lean, you have to have at the right place and the right time the patient, the providers, the appliances, like the equipment for minimal invasive surgery, like your X-ray machine, whatever appliances, medical appliances you might have, and of course your devices, your consumables, implants. But you also have to have the information and the knowledge about the patient, the providers, the appliances, and the devices, because nothing is worse than having all of these things together in the room, and you want to start the procedure, but information is missing. Working as an anesthesiologist, I had the situation regularly in my practice. The day before, when seeing the patient, I had ordered an X-ray or another lab test, whatever, and the next day I was there, the patient was there, the surgeon was there, but the information wasn't there, so I couldn't start the anesthesia. The surgeon didn't know Why? I mean, he didn't need the lab result. He would cut into the patient anyway, but I needed it, so I was the bad guy. And so it would be very nice to have at the fingertips, at the point of care, additional information like what's the English word for when you're looking for a villain and you put up a post? It's Steckbrief in German. I'm lacking the English word. I wanted notice, right. Something like that at the fingertips would be very nice. I told you my pharmacist has it, and I would like it for every product at the point of care. Okay, so from the pool providers, I would suggest that you sort of listen to the healthcare providers a little more, maybe build sections of the pool where groups of customers can store data that then are linked to the content coming from the vendor, who of course is the owner of the master data in the first place. That could be really nice additions. Thank you very much.